Today I am going to present about my clinical practice section. So my client name is Henry Yip. He is 22 years old. He is male and student. So about the medical history, he has no any past medical history, treatment history, drug history, and reflect. Also, he has no contraindication. For the social history, he has played football 1 to 2 times per week. He has do gym 1 times per week, and he is coming for his shoulder, lower back tightness, and hip tightness. Also, the shoulder climb. The shoulder will climb when he doing back squat and playing football. When there are someone to pump his shoulder, he will climb his shoulder. The tightness pain is pain scale 5 to 6. And about the analysis, because clinical section is only 45 minutes, so we will choose one problem to solve first. He want to solve his shoulder problem first, so we will focus on his shoulder. First, we will doing the subjective examination. I will do the observation first. He has the head forward posture, which means he has the pocket chin posture, and when I palpate his upper trapezius, I feel very tight and stiff. He has many trigger point on his upper trapezius. So next I will do the range of motion test, and after those tests, his next side flexion range is limited. The normal range is 45 for the active range of motion, so he only got 13 and 32. Also, for the passive range of motion, he got 38 and 37. The normal range is 45. And for the M view, I feel very hard to push further on the passive next side flexion M range. So also I have to do the upper trapezius muscle shoulder horizontal abduction resistance test. He feel the upper trapezius pain, climb, and stiffness. So I think his upper trapezius has overactive, because when we perform a shoulder horizontal abduction, mainly we'll focus on the mid trap and low trap. For the treatment plan, I've referred to some journal. The lower trap string glow can reduce the upper trapezius pain. So on the treatment plan, I will focus on strengthening his lower trap muscle. Also, I will focus on his shoulder problem first, because he want to fix it first. And about the clinical impression, I guess his diagnosis is the myofascial trigger point pain syndrome, because he has been overload his upper trapezius, and there are many myofascial trigger point on his upper trapezius. So I think he maybe got the trapezius myalgia. The symptom is tightness, stiffness, and pain. So why I think he has the mild trigger point pain syndrome, because there are many trigger points on his upper trapezius, and he is overused the upper trapezius. He used upper trapezius muscle for every shoulder movement. And why I think he may be got the trapezius myalgia because for the symptom for this diagnosis is there are some onset pain and muscle stiffness and spasm. Also there are tightness on his neck and shoulder in this case. And here is some reference. That's the end of my presentation. Thank you.